So firstly, thank you, JB, for asking me to come and speak to all of you. Thanks to the sponsors who have afforded me the opportunity to be here rather than in the office. And I guess I'm a little nervous sitting in front of peers and subject matter experts. But I hope what I can show you today is going to be helpful. We are a very different organisation, so most of you won't know who Gilead Sciences is. It's not a bad thing, because when you understand what we do as a business, you'll realise that the people, we have a critical role to play, but it's obviously for medical reasons. So I'm going to kick off by saying, this clicker doesn't work, so that's always a good thing. So James May is sitting over there, connected me with Jamie a while back, and Jamie then sent okay. So Jamie sent me a mail saying these are the events that we're going to be hosting, and I quickly responded. As I don't attend a lot of these events, I thought I better start getting myself into the scene. So I sent him a note back to impressive. So in the last 18 months at Gilead, we've been looking at doing things differently, fresh approach around recruitment, and rather than just evolving recruiters and our processes, looking at a change management on how we can do things differently. Many years ago, I read The War for Talent, the McKinsey's 1991 edition, and I was saying to a few people, I reread it a few months ago and realized that not much has changed, right? Except channels and technology. So, hence why we have to do things differently. So, what I'll do is I'll take you through the storyboard very quickly of Gilead, and I'll give you a context around why we have to do things differently and the challenges we have. So the organization, from a product portfolio, you shouldn't know any of those products unless that one over there, which is Tamiflu. So when you had swine flu, that was the toxic cocktail they gave you, made you feel better, stopped you dying, but didn't make you feel that good. The rest of them are predominantly virology products. So HIV, we have the #1 HIV product on the market. We have a very successful hepatitis B product. So this one over there is an HIV and hepatitis B product. And fingers crossed, we will be hopefully bringing the first cure for hepatitis C to market, and it will be the first cure since smallpox to come to market. So very exciting, innovative, real contact with what you do on a day-to-day basis. So a bit about the company, if I can get there. So our market capitalization is pretty impressive, $67 billion, and nobody's ever heard of us, so that's quite good. And you don't want to get revenue and customs chasing you. If you look at the number of employees we have, that's even more impressive. So again, 5,000 generating that market cap. And we were ranked in the top 5 best performing companies based on market cap to revenue ratio. To employee ratio. What gets even better is our revenues at 9.7 billion at the end of last year, and really that then brings us to me pushing this button rather. And there's a revenue to employee ratio chart up there, and you're not going to be able to see it from the table. But effectively, in 2011, both the Corporate Leadership Council and Harvard Business School did research on what a top-performing company would look like in revenue to employee ratio. And roughly about $500,000 is a top-performing company. So anything on the left looks very good, and then you get us on the extreme left, and we generate $2 million per employee as per the data at the end of 2012. Right? So you can start to get the understanding of some of the challenges we have as an organisation.
No one likes the challenges, by the way. That's
really hard.
budget.
Code review is going to be a really easy process for your employees going, I'm in charge of £2 billion.
However, you've got to remember it costs us $850 million to develop a product. So very quickly you can deplete the reserves.
Heart bleeds. Not literally, no, please no.
So there are more than 34 million people living globally with HIV. Most of those, unfortunately, are in the developing world, and as we know, they're the ones that need the treatment more than anybody. And currently, we have 3 million patients globally on Gilead HIV products. We provide this free of charge to the developing world. We partner with Indian generic companies, and we charge a royalty on the IP. So I hope this sets a bit of a scene. Yes, very high-performing company. We have the top scientists in the world. Last year, 2 years ago, we spent $11.7 billion on a molecule in development. So, we take high risks, very good calculated risks, and we need top talent, and we need the best talent quickly. So, what's the challenge for us? Recruitment, as we all know it. You'll all know this little slide. So everybody wants quality, everybody wants speed, everyone wants efficiency, and everybody wants that at next to nothing, right? So 100% and then save the money. So Gilead's no different, except for the end arrow is probably, it sits a little more horizontal than vertical. So what does it mean for us? Time, cost, and quality. As an organization, we're driven to reduce the time to hire, to manage the cost, and really to increase the quality. We need best-in-class people. So I took a bold decision and got some executive sponsorship to make the statement to the business that talent acquisition are subject matter experts in facilitating an effective process, but we're not responsible for recruitment. So I nearly had about 16 cardiac arrests in an executive leadership meeting. What do you mean you're not responsible for recruitment? Why the bloody hell did we recruit you, right? Get rid of him, get somebody else in. Well, the reality is none of these people report to me. I don't know the budget for it, and therefore why should I be the person that's accountable for it, right? And this brings me on to why I'm talking to you guys today, because this for me is where the fundamental issue lies within our industry, is that us as recruitment leaders, managers, professionals are constantly fine-tuning the recruiters to do more, right? Be more effective, right? Do more, reduce the cost. When the reality is that should it be them or should it be others that we focus on? So from a Gilead perspective, I said recruitment, but as Gilead has been doing it. So this is the exciting. Very, very one-off organization, very successful. Average time to hire globally, 100 days, right? The reality is in some of my markets, that's up to 200, 250 days. We're always breaking the bank. Just get Egan's in there, get Spencer Stewart in, get Russell Reynolds in, they'll find the people, right? No, they will remind you of the people we already know of for £100,000, right? That's what they'll do. Very, very effectively.
Very effectively. They're very good at that.
Very, very good at it, because they ask the question, right? I ask the question, who do you know? Nobody. They ask the question, there's 6 names that come out. I need to charge £100,000, maybe I'll get some names. But we decided we needed a plan A, B, or C. It didn't matter which one of the alphabet we decided on. But the important part was we had to do something different in this process. So I drive from Bromley, if you know the London area, Bromley to Uxbridge, Heathrow every day. So I have a lot of strategic thinking time behind the wheel, right? Some mornings a lot more than others. But I sit in the car, and it's been racking my brain for 3 years at being at the organization. What are we doing, right? We've got time to hire, we're focusing on it, we're reporting on it, we're managing it. We've got cost per hire, we're focusing, we're managing. And we've got quality, we're measuring the quality of the people. Yet we've hit a status quo. We just can't get it any further advanced in our performance. And then I came to realize that the big piece is this over here, right? Because the 3 areas we focus on is attraction, selection, and onboarding, right? But the recruiters over there have an influence of a piece here. When you do a time and motion study and you look at all the stakeholders and all the activities and your perfect recruitment cycle of needs analysis, advertising, attraction, and then your 5 CVs, 3 interviews, 2 final interviews, and a hire, perfect, right? Anybody who can put their hand up and say their recruitment works that well, I'm here to learn from you. And that's the piece that when you do a time and motion study around that, 2 weeks ago in San Francisco, I presented this to the leadership and said, do you understand that on an associate director and above level, we spend 100 hours on recruitment, and that's if it works perfectly. And they were like, that's far too much. What are we? We're not focusing on the business objective. Exactly. Right? So that has been the light bulb moment for us to start looking at the culture within the organization. And I've now got the executive sponsorship to start driving a different approach to our operational excellence. So away from just kicking the poor recruiters, but actually looking at the rest of the stakeholder group and who is performing in that process and who is optimizing our opportunity in recruitment. So it's a simple change management methodology. We've asked the question, what's the business objective? We're linking that to our mission statement of advancing therapies in life-threatening diseases. Who are our stakeholders? If anybody's following Dave Ulrich, that great HR guru, he spoke to us 2 weeks ago, and he highlighted the outside-in approach, right? Stop trying as recruitment professionals for fixing the problem. Bring your stakeholders in, make everybody accountable, right? And get their views on how we can as a collective, get this working. What's negotiable? So, it is time to hire in a quality process that important? It might be, it might not. Is cost per hire that important? What is not negotiable? Quality and legal, right? So we're not going to negotiate on quality, and the legal compliance cannot be compromised. And what does look like? What does good look like? So innovation. I love it. Our scientists sit there and say, we have just reduced the submission time for a new dossier to the FDA. Typically it takes 3 months, we've got it down to something like 7 weeks they've got it down to. How did they do that? Right? Not by doing the same thing over and over. And that's what I want the business to start thinking about. As we innovate in science, let's innovate in recruitment, because without people, they're never going to have the science and they're never going to support the patients that needs our therapies. So here are some of the things that we are now trying to do. This is very fresh, so I'd love to, if any of you are going to ask me, so how have we done it and what does this look like? Some of it we've managed to do already, some of it is really kind of, it's in infancy state. So outside in, so the stakeholders' views on effective recruitment, getting them to maybe help us identify how they can do it differently. Education. I don't know if anybody in this room has ever brought their recruitment partners, their agencies in and actually trained them on how you would like them to recruit for you. I haven't, right? We're about to do the first one.